Welcome, this is Tammy and I'm with NurseMinder, and in today's video we're going to be talking about how you can communicate with your colleagues, with your nurse supervisor, and even the physician or those specialists around the bed in a very clear and succinct way. We call it the SBAR, and we are going to dissect this right after this. Welcome back, my name is Tammy and this is NurseMinder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Alright, so we're going to talk about SBAR. We're first going to just mention a little bit about why we use it, when we use it, and then we're going to break down what each of these letters stands for. Now stick around to the end of the video because I do have a free download I want to talk about that you can utilize to make this even easier for you. So first of all, sharing a concern with a fellow colleague, your nurse supervisor or physician, you really want to make sure that people hear what you have to say so that they can understand you. It is extremely important in healthcare that when we pull together these pieces of information that we are concise and clear so that others can interpret the situation. In healthcare, one of the tools that we use to help communicate that information is called SBAR. Now, good communication skills are essential, and SBAR is a model that helps nurses clearly articulate key elements of a patient's experience so that the team can make informed decisions on care goals and outcomes. Now, for some people, whether you're new or you've been nursing for a long time, talking with a physician is an anxiety-provoking moment. I know because I teach a lot of students, and it is one of the things that really gives them a lot of concern. Now, it is true, there are some physicians and charge nurses and colleagues that will be way more excited to hear about what you have to share than others. And by excited, I mean they'll be open to hearing you, they'll want to know more information, and they might even explain their rationale to you. And then, of course, there's the other side of that. Those team members who are just focused in, out, give me what I need to know, and it may feel like they really don't have time for you. It does not matter which situation you're in. As a healthcare provider, you have a responsibility to advocate for that patient to the best of your ability, and that means sharing information. So that's why in this video we're going to talk about SBAR. It's a really commonly used tool to help nurses shape that information to make that conversation a little less anxiety-provoking. Okay, it's time to break down SBAR. The S stands for situation, and the question you want to be asking yourself, well, there's two questions you want to be asking yourself. First is, what is my major concern and what's going on right now? So you may be working with this patient for several days or it's your first encounter. It doesn't matter. What you recognize is that something isn't within the parameters of normal for this patient or progressing where you think things need to go. So for example, if you had come in and you're working with Mr. Terry Manor today, and Mr. Terry Manor is, say, a 56-year-old male who is post-surgery for a knee replacement, and you walk in and he is on the floor crying, holding his leg. That would not be the expected patient presentation you would hope to see if we were managing this patient's care. So what is going on right now is Mr. Terry Manor is on the floor crying in pain. Now in background, we're looking at the pertinent facts. So this is the patient's admission diagnosis and medical history. So if I were to build on Mr. Terry Manor is on the ground crying in pain, holding his knee, current situation. The background is he's post-op day 3 for a knee replacement to the right side, and his medications are morphine, 2 milligrams every 12 hours. And if there's any relevant past medical history, is this his first knee replacement? Did he have, is he obese? Are there mobility issues? Potentially any psychiatric history as well. You want to keep the relevant facts only in the background. A stands for assessment. This is where you're going to answer the question, what did I do? Well, you should be doing a set of vital signs. Anytime you call the physician, they're most likely to ask you what was their vital sign, so definitely do that. If this is Mr. Terry Manor, who's post-op day 3, he's on the ground crying, holding his knee, I will also include a pain assessment. I might include a mobility assessment. I might include a medication assessment. His last medication was given at this time. At that time, he was stating no pain, and now it's only been 2 hours and he's in uncontrollable pain. So the question is, what did you find, and what do you think is going on? So in your assessment, in your discussion with him, maybe he tells you that he banged his knee on the bed railing, and that's what knocked him to the ground and why he's in so much pain. Or perhaps when you assessed him, you found that there was a lot of swelling and oozing coming from that site, and you're thinking it's infected. And finally, R stands for recommendation. What do you need to have done, or what do you think should be done to help this patient? In our example of Mr. Terry Manor, perhaps what you're looking for is an increase in medication dosing. Maybe a one-time PRN dose to help him through this acute phase of his recovery. Perhaps what you would like for the physician to do would be to come in and see. So your recommendation might be, would you like to come up and see him and assess him? Or would you like us to order an x-ray because we're not sure if he's fractured it based on your assessment? His mobility maybe was deficient. Would you like us to order some lab work? Can we increase his medication dosing? All right, so let's just recap those pieces. S's situation, what is my major concern and what is happening right now? B is for background, what are the pertinent facts? A is for assessment, what did you find and what do you think is going on? And then recommendations, what would you need or want to happen right now and what should be done to fix the problem? So let's do the SBAR on maybe something a little bit more acute in that you haven't known this patient for a few days, but in fact, this is a new patient to your floor, to your emergency department, to your unit, or that you see in the community and you just walked in and this is the story that you get. We're looking at Mrs. Sonia Dubois. We know she's 27 years old and you walk in and she's now been complaining of feeling short of breath for 3 hours. So we can't SBAR yet because we need to do our assessment and do a little bit of digging around. So remember, S is for situation. The situation is she's been short of breath for 3 hours. Background, as we talk with her, we find that she initially came in because she had a cold that was unresolving for the last week, and that was her big concern. So background is cough and cold over 1 week. 1 over 52 is 1 week. And that she has been febrile times 24 hours. So as you've talked with her and you've gathered a little bit of history, you realize for background that she's had this cough cold for 1 week. She's been febrile for the last 24 hours. She has no history of asthma. She does have her immunizations up to date, and she's on no medications, and she has no allergies. So that's part of her background. Now, assessment, we need to actually look, listen, feel, find out what's going on with her. So after you have done her set of vital signs, okay, so we've done our assessment on Mrs. Dubois, and what we found is that her heart rate is 118, respiratory rate is 24. On room air, she's standing at 92%. She does have a lower blood pressure, 102 over 68, but this is our first time seeing her, so we don't know if that's her normal. And her temperature is 37.9, so she does have a mild fever. Because I want to focus in on her issue, she's short of breath, I'm going to do a focused respiratory assessment as well. And I note that her breathing is a bit labored. She does not have any accessory muscle use. She does have wheezing to both lower lobes. And no cough. Let's add that in there as well. Now the last thing is, what do we think is going on and what do we want to have happen? So this is for recommendation. Based on this history in this presentation, this could be maybe it's seasonal allergies. Right now it's spring here, so query, that could be one thing that you offer. And I believe it's always important to have a differential so that we don't get stuck and honed in on one thing. We should at least have 2 or 3 potential things that could be causing our patient's symptoms. So perhaps we think it's seasonal allergies. We're wondering if she's been exposed to COVID. So we're wondering if this might be a COVID patient. And then the other thing we're wondering is there any anxiety? So these are some of the things that we think might be going on. These are our differentials, but what do we want from the doc? Query, send a swab for COVID. Or isolate. Maybe get a Ventolin order. All right, so now we're going to put this together as if we're actually now sharing this information with our charge nurse or the physician. So you can see how it sounds. You don't have to say SBAR as you report it out. You certainly can. And maybe I'll just show you both ways. So, hi, I want to just report to you on Mrs. Sylvia Dubois. She's our new admission, that 27-year-old female who is complaining of shortness of breath. She initially came to us with a cough cold for a week's history, and she's been febrile for the last 24 hours. She has no history of asthma. She's positive for immunizations, are all up to date. She's had this year's flu shot, and she has no medications that she takes on a regular basis. And then she's negative for any allergies. I did her assessment, and her vital signs were a little concerning. Her heart rate's elevated at 118. Her respiratory rate is 24. Now, she is satting 92% on room air, but she has a temperature of 37.9, and her blood pressure is a little bit low. It's 102/68. After listening to her lungs and assessing her respiratory system, her breathing is a little labored, but there's no accessory muscle use, no cough, and there is some wheezing in the lower lobes. I'm not sure if this is seasonal allergies, and I'm wondering if she's been either exposed to COVID or she's really stressed about that. So I'm wondering if you would like us to swab her for COVID, isolate her, or maybe we can try a Ventolin order to see if that helps reduce her shortness of breath. I'm going to repeat that again, but this time I'm going to put in each of the headings to show you how you can still use those to help focus the information that you give. I'll just pretend I'm talking with the charge nurse. I'd just like to talk to you about Mrs. Sonia Dubois, that 27-year-old that just came on the floor. Her situation is that she's been complaining of shortness of breath for the last 3 hours. Now, her background is that she came to us with a cough cold for the last week. She did say she's been febrile for the last 24 hours. She has no history of asthma, allergies. She's not taking any medications, and her immunizations are up to date. In my assessment, I found her vital signs to include a higher heart rate at 118. Respiratory rate is elevated at 24, but her oxygen sats are fine at 92% on room air. Now, her blood pressure, I'm not sure if it's low for her, but it's 102/68. And she's febrile at 37.9. I did take a listen to her lungs and assessed her respiratory system. No cough, no accessory muscle use. She's a little bit labored, and there is some wheezing in the lower bases. Now, in terms of my recommendation, I'm not sure if it's seasonal allergies or this is COVID or even just stress related to those situations. So I'm wondering if we should ask for an order. I'm wondering if I can get an order for Ventolin to see if that helps support her, and if we should swab her for COVID and isolate her. So in summary, what we've covered today is a communication tool for nurses and healthcare providers that will really focus in on the relevant information that you need to share to help the healthcare team create the best possible outcomes and design solutions to the patient's problems. Now, in the description box below, what I've created for you is a download. Keep this on your clipboard, put it by the phone. It identifies each section of the SBAR, and it's got some script here to help you shape your conversation with the team. Thanks for watching. Be sure to comment below and let me know if this has been helpful. Like the video, subscribe, hit that bell so you get the notification when the next video is released. And until next time, make it a great day.